Hey, what's up, you guys? Dr. Knight Brian here from Mustard Seed Chiropractic, located in beautiful Smyrna, Georgia. What I have for you is a cervical x-ray, right, that I want to show you. And people think these are really cool, especially when it helps describe exactly what's going on underneath the surface for them, right? And so I'm here to help you learn about what's going on here. So here we have this lateral x-ray, if you will, or lateral cervical x-ray. It's as if I'm sitting here and you took an x-ray from the side of my neck. And what we're looking at here is a vertebra, right? Multiple, right here. These blocks look like bones. And then you also have the black spaces in between, and that is the disc space in between each vertebra. So let's check it out here on the model. Here's the model. This is a vertebra. This is the disc space, and this is another vertebra. And what we have here is a nerve and the actual nerve hole. So if we look at this comparison that I have here for you, what I want to show you is on the side here, we have these discs in between each of the joints, but here the discs look like they're starting to actually thin out. And if you start looking a little bit lower, it looks like we have these little boot-like structures coming off the front of the bones here. Those are spurs or osteophytes. And then it looks as if we go a little bit lower here that it's thinning out so much so that the joint actually wants to fuse together. And so what we're seeing here is a bunch of degenerative arthritis, big spurs, osteophytes growing off the front of the bone, and they're actually trying to fuse together to create stability. This neck had so much instability and degeneration that this person probably will not be able to drive. All because their neck will not be able to turn in a couple years. And if I'm honest, this could have been handled with chiropractic care. But the reality is this. Most people don't see what's going on underneath the surface. They think it's a joke, and they think that they just have some general neck pain, and they're not getting their spine checked and maintained and taken care of. So this is degenerative joint disease, degenerative disc disease, osteoarthritis, right? Degenerative joints all throughout the actual cervical spine. This is years and years and years of wear and tear of a person going through life without chiropractic care, possibly popping pills, maybe even doing some PT, doing all these different things to move joints around and move muscles around, but not really get anything structurally aligned so that the actual body can function how it is supposed to, okay? So of course you might ask, what could have been done about this? The reality is this person should have been going to the chiropractor 10 to 20 years ago. Yes, there's some work we can do to get this much better, even with a case like this. However, this person should have seen a chiropractor years ago, and it would have made a huge difference, not only in how they feel, but how they function for the years to come. Okay, so I do want to show you one more piece here. This is what we call 3D consult. We go through this with our patients. Notice all the neck muscles and all the muscles in the head here, and even the muscles across the shoulder and the chest. A lot of muscles in the actual body here in the upper part of the body. But notice this. We have our bones. We have the disc, but this yellow piece we're showing here is the nervous system. Look what happens as we continue to cause degenerative joint disease and that reverse curve throughout the spine. You put pressure on your actual cord and nervous system and pressure on the nerves that come out from the nerve hole. So as we can see, it's not just a bone issue. It's not just a joint issue or a mechanical issue. This is a nervous system issue. The brain is not going to communicate to the body how it is supposed to. If you will, a better analogy, the water from the water hose will not get to the garden how it's supposed to because there's a freaking tire on the actual water hose. How can we get fruit if the water can't actually get to the garden? So what we need here is adjustments to help bring this spine back into alignment, opening up the nerve holes and taking pressure off of the nervous system so this person can live the rest of their life and have the best of their life, functioning great and feeling optimally with chiropractic care. So remember, we're here in beautiful Smyrna, Georgia. If you know anyone who needs chiropractic care and they need excellent chiropractic care, they want to feel great, they want to function at their best, you send them here or you send them to a chiropractor near you. They will be so happy you sent them. They'll be happy that we broke this video down for them, and we can't wait to see you soon right here in our office. Dr. Knight Brian here. You guys take care. Have a great day.